Joining me now on Zoom is Director of Technical Services at the Ghana AIDS Commission, Dr. Fred Nanapoku. Doc, I'm grateful for your time this afternoon. First, let's understand what Ghana's situation is right now. What's the infection gap? Is it bridging or widening?
Right. Thank you very much, and thank you to your listeners and readers and giving us the opportunity to express some of these things. Currently, we're having quite a high number of new infections in the country. We have over 18,000 new infections, 18,928 new infections occurred in 2020 alone.
Okay.
And this gives us a total of over 346,120 persons living with HIV in the country in total.
So, if I understand you, in 2021, nobody has been infected with HIV/AIDS?
That is not the issue. The estimate has not been released for 2021 as yet.
Okay.
Usually it is done a few weeks or months at the end, after the end of the particular year.
Great.
So the figures that we are releasing now is 2020. At the end of December 2020, we had over 18,928 new infections.
Okay.
Created by His Excellency. About 28% of this occurred in adolescents, youth between the ages of 15 to 24 years.
Okay.
This are over 5,000 new infections. And the disturbing issue, and I think he emphasized the gender inequality as well. This number, 83% are females, and only 70% are males. This let us understand and see the gender disparity that is occurring in the country.
What do you think is... Okay, go ahead.
Yes, let's please go ahead.
Go ahead and explain to me, sir.
So it's very necessary that we have in place relevant strategies and policies that will ensure that new infections decrease.
But what do you think? What do you think is accounting for this figure that a lot more women are getting, or a lot more girls or females are getting than the males?
Right. So there are quite a number of factors. We have anatomical and physiological considerations based on the makeup of the different genders, right?
Okay. Yeah.
Structural barriers, structural considerations.
Yeah.
That we have mentioned some already. That includes inequalities, and that includes gender inequalities in the society.
Okay.
There are customary issues that also comes to play. Structural issues such as the level of education, the amount of education, girls' child being in school so that they have reduced risky behaviors. There's possibility and associated factors as well. So it is a combination of issues. And I must say that the Ghana AIDS Commission, together with our partners, especially the UN system, are looking at ways and means to help bridge some of these inequalities that we find in our society and in our environment.
What has been the challenge in reducing the infection rate over the years?
Right. One, there is a general notion that HIV is no longer of public health threat, which is not the case. It's still around, it's still persistent.
Okay.
And sometimes people tend to forget that the disease, the virus, is still with us. So the preventive modalities and structures that people used to have been put aside. Similar to maybe, I don't want to say COVID, I mean, over a few months, people are thinking that it's no longer very vital. So they are, in quotes, losing their guard and not going by the preventive method. So that is one of the key issues. We need to increase the information sharing, BCC activities across the breadth and length of Ghana for people to understand that the virus is still in our midst, and we need to adapt those preventive behaviors that we used to have.
Is it that we've relented? Is it that we've relented on challenges? Is it that we've relented on our efforts in creating awareness? That is why we're seeing this.
It's partly so. It's partly so, but I wouldn't want to blame it or I mean, like, say that is the sole cause of our woes.
What's the biggest challenge?
It is multifaceted. You know, it's multifaceted. I don't want to say that this is the one and most biggest or the biggest issue around.
Okay.
But there is issues about funding. There's issue about our own ability to appreciate and fatigue, I might call it in a way, fatigue in adapting preventive, and sometimes we are even sources of our own. We fall victim to our own successes. Okay. The presence of vital antiretroviral drugs, which is good, though they don't cure, but treatments. People tend to think that HIV and AIDS is no longer, in quotes, scary and adapt any risky behavior without thinking of its consequences. So, and then some of our cultural practices where there is imbalances in power play, especially during negotiation for sex and all that, where a woman don't really have the power to negotiate effectively for the use of condoms, and it's all at the discretion of the man. So that imbalances in power dynamics is also a contributing factor to what we are seeing now. Yes, so we need to increase this awareness and this education among all sectors of research, especially the youth, because some of them were not even around when those intensive campaigns were being carried out. So now growing into AIDS, it becomes a big challenge because they might not have had those initial campaigns on ABC, abstinence, be faithful, condom use, and all that happened 2, 3, 4 decades ago. So we need to revisit these campaigns, which the Commission and partners are vigorously and aggressively and pragmatically looking at how to revive all these campaigns.
So what's the plan for this year? What's the plan for this year? Because we've heard the president expressing worry over the situation in which we find ourselves now. He talks about structural issues. He's talked about stigma and what have you. You rightly mentioned that structure issues, how educated people are, is also causing some of these situations we're seeing. What's the plan for you at the Ghana AIDS Commission?
Thank you very much. So the plan is quite, not, I wouldn't say simple, but it is extensive that we can all look at, and it's for everybody. We don't want to leave anybody behind in this plan to ensure that we are able to bring down the tide. We have developed a strategic document, the National Strategic Plan that will run from 2021 to 2025, a 5-year strategic plan, and it details the prevention modalities that we want to adopt. It goes into details and help us target the relevant populations as well. And we know that treatment is also very crucial, because currently we know that people that are effectively taking their medications and attain viral suppression are unable or incapable of transmitting the viruses sexually. So treatment being helpful for the individual who is on the drug is also a preventive strategy, what we call treatment as prevention, because at that point where you are virally suppressed, even when you have sex with an uninfected partner without using condoms, as it is, you are unable to transmit the virus. So the commission is looking at all these preventive modalities and treatment modalities and looking at how effective we can make these among the populace. We are also looking at prevention of mother-to-child transmission. And indeed, that alone accounted for quite a number of new infections in Ghana. In 2020, we can have, I think we had over 3,000 infections that were due to mother-to-child transmission. So, in ensuring that every mother undergoes the prevention of mother-to-child transmission services or receive that services, and then follow the laid out modalities and protocols, then we are sure that infections that are being brought into Ghana through mother-to-child transmission will be curtailed. Yeah, because the coverage for PMTCT services in 2020 was about 71%. It means that there is still some gap.
Okay.
And we need to strengthen all the various structures, be it in the health system, be it in individuals' customary and understanding of issues. You know, the health-seeking behavior of our populace is another thing that we have to work on.
Dr. Nanapoku, I'm aware that the 2021 statistics will be done getting close to the year. I don't know if you've put together something already, but what can you say from the information that you have? How is it looking like?
Yes, so the process had begun, and we hope that latest in the first quarter of 2022, we will have those figures, estimates being ready. But it is quite promising. We will see some changes. We will see some improvement in the data, in the indicators that we have set for ourselves as a country. And we are still working on them, and we hope that when it's all out, we will all be happy about what is currently happening, and we will see a downward trend on some of these indicators as it is.
Yeah. Well, I do hope it makes us happy. Dr. Fred Nanapoku is Director of Technical Services at the Ghana AIDS Commission, and he's been explaining to us the situation with our HIV/AIDS status.